So now we are going to hear, not from Mary as it says on the slide there, but in fact from Andrew Cockayne. Mary unfortunately can't be here with us today, but Andrew's kindly stepped up to the plate. And he's going to tell us all about the Patient Connect and Staff Connect and how it's impacted across a number of NHS settings and how it has helped move patient experience forward. So over to you, Andrew.
Thank you very much, everybody. I hope everybody can hear me okay. I love these webinars. It's so convenient, so fantastic. Thank you very, very much to Patient Experience Network and NHS IQ for organising us today. It's fantastic. We are here today because we were shortlisted in the category of innovative use of technology and social media. That means that our peers, people like you on the call, like what we do. They like something they saw in the proposal. That's how the Patient Experience Network National Awards are judged, which is fantastic. It's a very, very supportive network, and I'm sure you'll all agree. I just want to apologise for not being Mary McKenna. Mary had to fly off out the country today, so you have to put up with me instead. We are a bunch of innovators and social entrepreneurs, people who try and make a difference in life, like you, like everybody on this call and in this network. So over the course of the last 3 or 4 years, we have built a system. It's an integrated suite of software. One half faces patients, called Patient Connect. One half faces staff, and is called Staff Connect. We know that there are huge savings in the form of the one-less savings, better patients, less demand on the system, as well as in the form of unlocking the benefits of staff engagement, reduced turnover, reduced absenteeism, reduced costs of recruitment, agency staffing, etc. Put those two things together, build the organisational culture that Louise so helpfully focused on in her introduction, and you have a really positive spiral. That's what Patient Connect and Staff Connect are all about. So we called this talk Better Information, Better Care, Better Outcomes. And I'm just going to skirt over some of that theoretical background, some of the evidence base for why we do what we do. And this is going to be familiar to many, and if it's not, there's some references there on the slides. So 5.5 million people in this country don't get the information they need at the point of diagnosis. 3.2 million people don't feel they have enough information to discuss their condition with their doctor. Some people would say that that's tantamount to neglect. In terms of care, we've seen in the past few years the structures of care really being reorganised around the patients to put the patient at the centre of their care in response to the mid-status inquiry and in documents like the 5-year forward view. We know, as you do, that in order to get that right for every patient, every day, you need really robust systems and processes and staff training. It doesn't just happen. We need to organise that care. And the prize is great. So the evidence shows that informed patients are better patients in terms of clinical outcomes, in terms of quality of life, and in terms of their personal financial benefits as well. Additionally, enter the one-less savings, better patients and better informed patients cost the system less money. So we have a white paper on this that explores this evidence base. It's co-written between myself and Mark Duman, who's the founder of the Patient Information Forum, and we have a dedicated webinar on this on 10th of November, same time as this one in a few weeks' time. You can find out more on our website. So what? We've talked about better information, we've talked about better care and structures of care, we've talked about better outcomes. So what did we do about it? Well, patient care is a journey, and we think of the journey through life with a long-term condition as a really useful analogy. So 4 or 5 years ago, I was a head of patient experience in the NHS. I've been an organisational development bod, helping make organisations better. I looked around and said, well, who is out there using new technologies to make that journey that little bit easier for patients? And this was the vision. These were the sort of questions I was asking. So it's a long and windy road. And that's my road. It's my journey. It's a personal journey. But it's going to have some common features. That point of referral will be common to everybody who's on that journey, but it will happen at a different time, have different conversation, different content. It's my referral. There might be, in a simple pathway, a moment of diagnosis and some treatment, discharge after that, etc. The road is long and windy. Let's just focus on those two steps or anchor points in that journey. What do I need to equip me along the way? Well, I might want to know what to ask my doctor before I go to the diagnostic appointment. I might want some information about self-care after that. Now, those things are common to everybody on this journey, but the timing of those are very personal. Too soon, the self-care information, I'm not going to read it, I'm not going to access it, I don't want it, I don't want to know. Too late, it's no use to me. So we might need personalised packages of support that would be common to everybody on this journey, but the timing of which would be personal to me. What about the physical places that I visit? They're scary. You know, the day that you go to hospital for that test or for that treatment is one of the worst days of your life. So how do we make that more accessible? How do we use technology to improve that experience? So each of those settings are physical settings with a physical location. I can use new technologies to create a geolocation for those and trigger information and support, human, personal information and support, personal stories, personal messages, potentially access to support groups. I can do that as people walk through that door of that appointment, of that diagnostic setting, or the place they're going to get treatment. Or I can do that on a schedule afterwards. And that support, that signposting is going to be to human beings, real people who can help me, people who've been on this journey before me. Perhaps they're on the same road, just a little bit further along, but they can help me on my journey. And then patient feedback, something we spend a huge amount of time and effort on in the system. Patient feedback sits within that context. And I want to break those questionnaires up into bite-sized chunks. I want the questions about the diagnostic appointment close to the diagnostic appointment. I want the questions about the treatment or the referral close to the referral or close to the treatment, and so on and so forth. You get my point. So in order to do that, I need a system that can really understand where I'm at in the system, what pathway I'm on, what my physical experiences are, and can use those as triggers for the dissemination of complex information of all different types, including batteries of questions for my patient experience questionnaires to make them much more relevant and real and tangible. So that was the vision, and this is the reality. It's called Patient Connect. And the vision that I had as the head of patient experience 4 years ago, I stepped out of the NHS and I made that vision a reality. And we've got clients, North Middlesex University Hospital, Ipswich, Merseycare, Birmingham Women's, CLCH, Community Acute Mental Health, who are benefiting from this technology. We have a really powerful survey editor built into that, unlimited surveys assigned to different people on different pathways at different points in their journeys in order to unlock those benefits of bringing the questionnaire closer to the true patient experience in order to understand that better. We're using the power of new technology, not as a data collation mechanism, but as a true platform or a user interface, a method, one among many methods of engagement between the trust, the provider organisation, and the patient. We can increase accessibility and we can personalise the experience using this platform. So there are clear benefits. Reduce costs for the patient, better outcomes, the 30 billion of savings if we educate and inform, culture change, caring environment, etc. So the panel judges liked this. They liked what they saw here. But this isn't it. This isn't all. We've turned that around to face staff as well, as a staff engagement mechanism, because we know that to make a difference to patients, you need a fully engaged and fully supported staff group, the right information at the right time when they need it. Think about the power of new technologies for a workforce where 75, 70, 65% of the workforce is not sitting at a computer every day. They don't have access to that, easy access to that information, the tools that they need for their job, the clinical pathways, the policies, the procedures. We can put all of that in their pockets securely, as well as cascading all sorts of information, performance, KPIs, all those sorts of things, the staff directory, etc. So I'm going to wrap up there and put it out to questions. So I think it's really valuable to have that exchange and hear people's responses to the presentations that we've had. But before I do, I just wanted to say thank you. I say thank you to the judges, because a lot of people give their time with no real reward other than the reward of being part of fostering innovation and celebrating good practice. I want to say thank you to the Patient Experience Network team for organising us, but particularly thank you to everybody who comes to these events and makes these events happen, be it a webinar like the one we're doing today, or the event that we attended back in the spring, and I'm showing on screen now. They're great days, and I really urge everybody to continue to take part. We were shortlisted in 3 categories this year. Amy from Birmingham Women's is going to be speaking at a future one of these events, so please come back and hear it from the horse's mouth from Birmingham Women's Hospital. Ditto for the Ipswich Hospital NHS Trust. We've got the Head of Organisational Development joining us for that session. And Captive Health is going to do a couple more webinars afterwards. Have a look at our website and feel free to book onto those if you want to give it your time. We've got some real experts, and you will get the chance to hear from Mary on another day if you would like to do so. So thank you very much. You know where to find us, and look forward to taking some questions.
Thank you very much indeed, Andrew. Again, another very interesting presentation there, which has really sort of helped to enlighten us about how new technology can help both patients and staff to connect and to ensure a better outcome. I liked the journey analogy. That helped me, and interestingly, it took me back to one of the key findings of the report, the Keep It Simple, help to make sure that you can I mean, I'm a bit of a technophobe, so anything technology, my eyes usually glaze over. So to have that journey analogy really helped me to understand how this would help. So thank you very much indeed, Andrew, for stepping up to the plate and running us through the Patient and Staff Connect app. I have a couple of questions here. Okay, well, I have one question each for Sue and Andrew. Shall I start with Andrew, because he still has the ball, so to speak. I know that, Andrew, there are going to be other people coming on in the future to give us their view from the horse's mouth, as you mentioned. But could you just give us a quick, either 1 or 2 examples just of where it's worked well, and just a couple of bullet points on how they, what sort of challenges the organisation has had and how they might have overcome them?
Yeah, sure. I mean, I think, and you can hear more from others on future events, but I mean, with the patient experience, patient feedback provider for Birmingham Women's Hospital, we've just collected our 50,000th instance of feedback last month, which is very pleasing. So, you know, all of that data going off to Unify in the normal way, etc. And we have some innovative tools for those people. So, you know, when you walk on site at Birmingham Women's Hospital, you get a welcome message on your smartphone that says hello. In fact, that says anything that the client, in that case, you know, Birmingham Women's wants it to say. It's all content managed through a control panel. So that message can be changed at any time. When they leave, they get a goodbye message that says thank you and I hope you had a positive experience, and includes a link to the feedback module and pushes them towards you know, giving feedback and logging in and so on. And that has a positive impact on response rates. So that's just one example of how, you you can use new technologies to do some of the things we've always done in a slightly different way. It's not suitable for everybody, but for those people whom it is, they enjoy it and they use it well. What are the barriers there? Well, some of this stuff cuts across silos, and in fact, if you look across the Staff Connect and the Patient Connect, we find the most positive projects where the whole team is engaged. By the whole team, I mean across the execs, across the silos within the organisation. So, one of my favourite of our clients, the project leader is the deputy chief executive. He, pulls people together in the steering group, and together we make things happen. So, you'll need your comms team engaged. You'll need your HR people engaged. You'll need your patient experience people engaged. You'll need anybody who's got a view to performance and organisational change. But these things are fantastic. These sorts of projects. You can do a whole set piece, organisational project, or you could think about, a microcosm of your organisation. So one of our clients is Merseycare NHS Trust. I think they may be entering for an award this coming year. They've set up an online panel of 10% of their staff. They call it the Merseycare 400. 4,000 staff in the organisation, mobile workforce, and they're using our technology as a way of really, as a sounding board, an online panel. So the idea is that if those 400 people have been consulted about an organisational change or directional strategy, etc., then I can assume that, even if I'm not part of that group, I can assume that it makes sense, and somebody like me has had their say and has had a say on this. At which point, I'm more likely to accept it as something that is well thought through and positive for the organisation as a whole. So, a couple of examples there of people using this technology in very creative ways, and watch this space. Fingers crossed, we'll be able to support one of those back to the event next year, and hopefully they can pick up an award.
Thank you very much indeed, Andrew. That was a lovely comprehensive answer. I think it's just given people a flavour of some of the organisations and some practical examples of how it's actually helped in there.
So, I was, as a practitioner and somebody who's been in the system for a long time, helping organisations, public sector organisations, through change for the best part of 15 years. I was actually startled to read the evidence base. The reason we've put this white paper out recently with Mark Dewman around the benefits of patient information is really because that story simply isn't told enough, and I think that there's a real challenge with this stuff, isn't there? So we all wrestle with finding the right budget line in our organisation, helping getting the right people around the table, etc. And some of the benefits, the system benefits, they cut across the whole system and they affect lots of people in a small way, and the benefits come down the line. So another challenge, just in response to your question, is around there's no instant cashable saving for making some of these changes, and we all know the pressures on NHS trusts at the moment. And I suppose one of the challenges is finding inspirational leaders like the people we've got on the call today, who can make some of these innovative these innovations that have worked elsewhere, make them happen. And I suppose I would urge people on the call to think, who is it in my organisation that I can bring on board, or I can petition, and if I put a good enough evidence base in front of them, they should really take that, take the bull by the horns and try and do some of these more innovative things that we see producing really good results elsewhere across healthcare.